Good day, everyone. My name is Gilbert. I'm a registered nurse and a point of care testing coordinator at Dubai Academic Health Corporation. Welcome to this clinical skills demonstration designed specially for our newly hired nurses. So, in this session, we will focus on one of the most essential procedure in nursing practice, the capillary blood glucose test. Accurate and timely blood glucose tests play a crucial role in managing patients with diabetes, monitoring treatment response, and preventing complications. Together, we will explore not only the methods, but also the underlying principles that support safe and effective glucose monitoring. So let's begin with our learning objectives that is aligned with Bloom's taxonomy. So by the end of this session, you will be able to recall the purpose and indication of blood glucose testing. Number two, explain the principles and types of glucose tests. Next, demonstrate the correct technique for capillary testing. Analyze factors affecting accuracy. Evaluate infection control and quality practices. And finally, create or adapt a protocol for safe practice in your workplace. So why blood glucose monitoring is important? It helps us identify patterns in the fluctuation of blood glucose levels that occurred in response to diet, exercise, medication, and pathological processes such as diabetes mellitus. Unusual high or low blood glucose levels can potentially lead to life-threatening conditions, especially for individuals with diabetes. It helps prevent complication and guides treatment decisions like adjusting insulin therapy. There are several types of blood glucose tests, each serving a distinct purpose in both diagnostic and ongoing patient care. First, fasting blood sugar. This test is done after at least 8 hours of fasting, typically in the morning before breakfast. It gives us a baseline reading of a person's blood glucose without the influence of food. It is commonly used to screen for diabetes. Next is postprandial blood sugar. This is measured 2 hours after eating. It helps assess how well the body handles glucose from a meal. It's particularly useful for patients on insulin or those being monitored for glucose tolerance. Next is random blood sugar. As the name suggests, this test can be done at any time, regardless of meals. It is often used in emergency or critical care settings to quickly identify hypo or hyperglycemia, especially in symptomatic patients. Next is oral glucose tolerance test. This is a multi-step test usually performed over a 2-hour period. After taking a glucose-rich drink, the patient's blood sugar levels are tested at specific intervals. It is a gold standard for diagnosing gestational diabetes and glucose intolerance. And lastly, capillary blood glucose testing. This is what we'll be focusing on today. It involves obtaining a drop of blood from a fingertip using a lancet and measure it with a glucometer such as this one. It's a quick and non-invasive, cost-effective method used for point-of-care monitoring, especially in hospitalized or diabetic patients. So, point-of-care glucose testing is indicated for patients who are in insulin therapy or those who are in critical conditions or post-op monitoring. It is especially useful for anyone with altered mental status where you want to quickly rule out hypo or hyperglycemia. So what are the equipment needed for this testing? Of course, you need a glucometer, a compatible strips, a lancing device, alcohol pads, gauze, and gloves. Now let's walk through the procedure step by step. First, you have to introduce yourself to the patient and explain the procedure. Next is you have to perform the hand hygiene and always wear gloves. Next is prepare the equipment and select the side of the fingertip, clean it with alcohol and let it dry. With a single-use lancet to puncture the skin, you have to wipe the first drop of blood and collect the second. Apply the blood to the test strip, wait for the glucometer to display the result, and dispose safely and document immediately. We'll be having a return demonstration later so you can practice this technique. Remember, infection control is crucial, so always use gloves and never reuse lancets, and disinfect glucometer between patients. You have to follow your institution's guidelines strictly, and remember that glucometer can be a vector for infection if protocols are ignored. There are several factors that can throw off your results, such as dirty hands, expired strips, insufficient volume sample, improper storage of strips, or even patients-related factors such as high hematocrit can impact reading, so always be vigilant. So here's a quick guide how to interpret the results. For normal fasting blood sugar, it is 70 to 100. If you're having 100 to 125, you may need lifestyle modifications. If it's above 126, you might be having diabetes. And if it's below 70, you're suffering from hypoglycemia. So after the testing, documentation is your next priority. You have to record the time, value, and any intervention. If the results are abnormal, so you have to notify the appropriate clinician immediately and always chart the patient's response and actions taken. Hi, my name is Gilbert. I am your nurse for today. So I'll be checking your blood sugar. This is just a quick routine finger prick test that gives you an idea of your current blood glucose level. So it's just a small prick on your finger. Is that okay with you? So I'm just going to clean my hands and put on my gloves for hygiene and safety purposes. Alright, I've got all the equipment ready. I'll just wipe your finger with alcohol. And wait a few seconds to dry it so it doesn't affect the result. Okay, 3, 2, 1. Alright. I'm wiping the first drop of blood and I'll be collecting the second one. Alright. So just keep it on hold and we'll wait for the result to appear. Alright, your current blood sugar is this. Alright, I'll go ahead and dispose all the equipment and everything safely. So now it is your turn. I will call each of you to do a return demonstration using our training glucometer, and I will be observing you using a checklist. I'll give you a constructive feedback afterwards, and don't worry, as this is a safe space to practice. Just a recap, blood glucose testing is a vital skill. Proper technique ensures patient safety. Always practice infection control. You have to understand how to interpret and act on a result. And finally, document everything. Thank you for being part in this clinical skills demonstration. I hope today's session empowers you to perform blood glucose testing with greater confidence and accuracy. This skill is more than just a routine procedure. It's a vital part of patient care that can significantly impact diagnosis, treatment, and day-to-day management of conditions such as diabetes. As you saw, attention to details at every step matters, from ensuring proper hand hygiene and using the correct technique with lancet, to applying an adequate blood sample to the test strip and interpreting the result accurately. Consistency and care in this process helps ensure reliable readings and ultimately better outcomes for your patients. It is also important to understand how to troubleshoot common issues such as insufficient samples or error messages, and to educate patients on proper home testing techniques when needed. Whether you're working in a hospital, a clinic, a community health setting, your ability to carry out this test with professionalism and precision contributes to the quality of care we strive to deliver. Thank you again for your focus and participation today. Keep practicing, ask questions, and continue refining your skills, because every step you take towards clinical excellence helps build safer and more effective care. Have a great day, everyone.